Ding Ding has this disease. There's no cure, only amputation. Hello, everyone. I am Cherry. Lao Ma found that the head and coronal sulcus of his Ding Ding were red and swollen, but the discomfort in the private parts made him difficult to talk about. He was reluctant to go to the hospital for treatment, which delayed the disease and finally diagnosed penile cancer. Although penile cancer is relatively rare, it is a malignant tumor that seriously threatens men's health. There are about 26,300 new cases worldwide each year. In my country, the age of onset of penile cancer is advanced, accounting for 28.6 before the age of 40, with a peak of 41 to 60 years old and an average age of onset of 49.1 years old. How does penile cancer come from? The causes of penile cancer are relatively complex, mainly related to the following factors: phimosis or excessive foreskin. This is an important predisposing factor. Due to excessive foreskin or phimosis, the secretions between the inner plate of the foreskin and the glans penis are difficult to discharge, and smegma will form. Long-term accumulation of smegma will continue to stimulate the glans penis and the inner plate of the foreskin, causing chronic inflammation, and then increase the risk of cell malignancy. HPV infection, human papillomavirus HPV infection, is also an important factor, especially high-risk babies such as HPV 16, HPV 18, etc. Some of their gene products can interfere with the normal proliferation and differentiation of cells, causing malignant transformation of cells and ultimately leading to the occurrence of penile cancer. In many case studies, HPV DNA can be detected in 70 to 100 of intraepithelial of a papilloma and 40-50 of invasive penile cancer. Bad hygiene habits. Not paying attention to the local cleaning of the penis. It is easy to breed bacteria, increase the risk of infection, and long-term stimulation may also induce cancer. Smoking. Long-term smoking is associated with the incidence of penile cancer. Nicotine, tar, and other carcinogens in tobacco will enter the blood circulation and have adverse effects on penile tissue. To be alert to these symptoms, which may be characteristics of penile cancer. The early manifestations of penile cancer are diverse and obvious. Common symptoms include 1. Penile ulceration and pain. If the foreskin can be turned up, red plaques and papules can be seen on the head of the penis. The lump is hard. The central ulcer has irregular edges, and it is a cauliflower-like tumor. The erosion that does not heal for a long time is covered with purulent secretions, and there is stinging or burning pain and a foul odor. 2. Abnormal secretions. The early cancer of patients with phimosis is often difficult to find. Patients who touch the lump through the foreskin have purulent and bloody secretions flowing out of the foreskin, which is itchy and painful. 3. Abnormal urination. As the disease progresses, the tumor gradually increases, invading the surrounding tissues such as the penis cavernous body and urethra, causing symptoms such as dysuria and hematuria. For lymph node enlargement, the lymphatic metastasis of penile cancer first occurs in the inguinal lymph nodes, which may cause lymph node enlargement and pain. If hematopoiesis metastasis occurs, it may metastasize to distant organs such as the lungs and liver, and in severe cases, it may even endanger life. 3. How to scientifically treat penile cancer? The treatment of penile cancer is mainly surgical treatment, combined with comprehensive treatment measures such as radiotherapy and chemotherapy. The specific treatment plan depends on the tumor stage and patient condition. 1. Surgical treatment. Local resection. It is suitable for patients with early stage and tumor limited to the glans penis or coronal sulcus. The operation aims to accurately remove the tumor and preserve the function of the penis. Partial penis resection. It is used when the tumor invades a large area, but there is still a part of the penis that can be preserved. The part containing the tumor is removed. Although urination and sexual function will be affected after surgery, they can be improved with the help of rehabilitation assistance measures. Total penis resection. If the tumor invades the penis extensively and cannot be partially removed, this procedure is required. Although it will cause penis loss, it can effectively control tumor progression. Urethroperineal stoma is often required to solve urination problems. To radiotherapy, it can assist surgery to reduce the size of the tumor and reduce the scope of resection. It can also be used for those who cannot undergo surgery to control symptoms and tumor growth. It includes external irradiation and close-range radiotherapy. 3. Chemotherapy. It is mainly for patients with metastatic penile cancer when there are multiple metastases in the body, or as a preoperative adjuvant. Strive for surgical opportunities and post-operative supplement enhancement of efficacy. The individual efficacy varies greatly. Prevention is better than everything. What can we do? 1. Get the HPV vaccine. The HPV vaccine can effectively prevent the HPV infection, thereby reducing the risk of penile cancer. There are 3 types of HPV vaccines currently available in China: bivalent, quadrivalent, and non-avalent. Among them, quadrivalent and non-avalent vaccines are suitable for men. The Centers for Disease Control and Prevention (CDC) recommends that boys and girls get the HPV vaccine at the age of 11 or 12 to ensure that they get the maximum benefit of the vaccine before starting sexual activity. Older men who have high-risk behaviors such as multiple sexual partners and low immunity can also consult a doctor whether it is appropriate to get vaccinated. To pay attention to personal hygiene, keep the penis clean and dry. Wash it with warm water every day, especially the surgical site or radiotherapy area, to avoid bacterial growth and infection. For those with phimosis or prepuce, it is recommended to undergo circumcision as soon as possible, which can effectively reduce the incidence of penile cancer. 3. Regular physical examination. Regular physical examination of the penis area to detect potential lesions early and treat them in time. For people with high risk factors such as phimosis, prepuce, HPV infection, etc., screening should be strengthened. 4. Maintain a healthy lifestyle. Quit smoking, limit drinking, strengthen physical exercise, maintain good personal hygiene, etc., which can improve the body's immunity and reduce the risk of HPV infection and penile cancer. Although penile cancer is serious, early detection and treatment can improve the cure rate and quality of life. If you find abnormal symptoms in the penis, such as ulcers, lumps, abnormal secretions, etc., you should go to the hospital for treatment in time. In the face of this unspeakable secret, refusing silence and procrastination is the most powerful weapon to truly protect men's health and the dignity of the family. Please remember, the right to life and health is above all else.